Social phobia is a fear of being in places, social situations, where an individual might be watched or evaluated or scrutinised in some way. So we're talking about situations where the person might be the centre of attention, or even simple conversations where one person is looking at another. So the anxiety in those situations for the individual with social anxiety is quite overwhelming. And their fear is that they will be seen to be anxious and will be considered to be different, strange, unusual, inept, incompetent. In other words, they'll be evaluated negatively by the people who notice their anxiety. Look, relatively common, about 4% of the population, 4 to 5%. Now, it can be a fairly circumscribed sort of concern in that it might just be performance situations such as public speaking. Some people really fear public speaking, have overwhelming anxiety as a result, and will avoid it at all costs. On the other hand, there are many people who have what we call generalised social phobia, and these are people who are afraid to have conversations in a small group of people, afraid to attend parties, social gatherings, etc., for fear that they might be seen to be anxious and people will evaluate them negatively. So what the whole concern is, it's with the physical symptoms or physical manifestations of anxiety that others might see, such as blushing, hands shaking, voice trembling, etc. So for these individuals, they would much rather avoid social situations, or if they have to go to something, they'll just grit their teeth and put up with it and get out of there as soon as they can. Well, yes, it will affect their family members in that, depending on the severity of the social anxiety, the individual may not be able to attend family functions. The individual may not even be able to attend family dinners, even in their own home, if there are strangers or a group of people who are invited over, etc. And the other important thing to notice with social phobia is that it interferes with people achieving their full potential. So that if my concern is of speaking in public or being seen to be anxious by other people, clearly I'm going to have difficulty with school presentations, university and TAFE presentations, or even job interviews, so I will avoid them. Well, with cognitive behaviour therapy, there are certain medications, the serotonin reuptake inhibitors, that are useful in the treatment of social anxiety disorder, but more importantly, it's a matter of teaching individuals to change the way they think about these social situations, that people are not really interested in them to the degree that they believe they are being scrutinised and evaluated. In other words, we challenge the probability of something like negative scrutiny or evaluation happening, but also the cost. Now, the cost basically means, well, so what if it does? Okay, so using cognitive behavioural techniques, we expose the individuals to a variety of social situations so that their anxiety dissipates. Also change the way they're thinking about those particular situations.